Splenectomy in hematologic disorders. Definition: an splenectomy is a surgical procedure that partially or completely removes the spleen. In some indications, such as Gaucher's disease, has partial splenectomy replaced total splenectomy.
The spleen is a relatively fragile organ located in the upper left abdomen behind your stomach. It helps produce, store, and filter blood, and it also plays a role in the body's immune system. A severe impact to the left side of the abdomen can result in damage to the spleen. A splenectomy is the surgical removal of the spleen due to injury or illness. During surgery, the damaged spleen is removed and its attachment to blood vessels is severed. The liver takes over the functions of the spleen after it is removed. But the blood is not filtered as thoroughly, leaving people without a spleen prone to more bacterial infections than before.
Applications in medicine. Splenectomy is performed in patients having hemolytic anemia because the intrinsically abnormal or antibody-coated red blood cells are prematurely destroyed by splenectomy splenic macrophages.
Body that works to clean your blood. The spleen is located behind the stomach and to the left of the liver. Specifically, the spleen picks out and destroys red blood cells that are no longer useful.
Advantage: splenectomy can ameliorate the underlying anemia. It is often considered the treatment of choice for such conditions. Disadvantage: after a splenectomy, the liver takes over the functions, but the blood is not filtered this clearly. Many people without a spleen suffer more infections than before.
Finally, the spleen is maneuvered into a special retrieval bag, where it is broken into smaller pieces and removed through one of the laparoscopic working ports.
About diseases, they are blood disease, blood congestion, Gaucher's disease, white cell suppression, growth of tumor, growth of cyst.
Our red blood cells make up 40% of our blood's volume. They're made continuously in the bone marrow, looking like flattened donuts without the holes. Red blood cells contain hemoglobin, a bright red protein which gives blood its color. When we breathe, as our blood passes through our lungs, oxygen molecules attach to the hemoglobin. Then, the red blood cells and hemoglobin transport the oxygen throughout the body and release it to all our cells and tissues. When the hemoglobin molecules are emptied, they attract carbon dioxide and other waste gases, which they take back to the lungs to be exhaled. Anemia occurs when there are too few red blood cells or not enough hemoglobin. Exhaustion is the common sign of anemia.
Thank you.